Hello, so welcome back with yet another card. I'm Priyanka from Let's Update Language Academy, and this is
And to Sebastian.
from Let's Update Language Academy, one of our trainers. So today we are with a different card. Okay, last examiner, June 22nd, a similar card വന്നിട്ടുണ്ടായിരുന്നു. So we thought that we should come with this card because എല്ലാ കാർഡിലും നമ്മൾ വളരെ സിമ്പിൾ ആയിട്ട് കാര്യങ്ങൾ കംഫർട്ടബിൾ ആയിട്ട് പോകുന്നു. എന്നാൽ ഈ കാർഡിൽ കുറച്ച് എന്താ പറയാ മെഡിക്കേഷൻസ് നെയിം ഉണ്ട്. സോ അത് വരുമ്പോൾ നമ്മൾ കുറച്ച് കൺഫ്യൂസ്ഡ് ആവുന്നുണ്ടോ, പാനിക് ആവുന്നുണ്ടോ? ലെറ്റ്സ് ചെക്ക് ഇൻ ടു ദാറ്റ്. അപ്പോൾ ജൂൺ 22nd എക്സാം എഴുതിയ സ്റ്റുഡൻസ് എല്ലാവർക്കും യു ക്യാൻ കമന്റ് നിങ്ങൾക്ക് ഈ കാർഡാണോ കിട്ടിയെന്നുള്ളത്. ഓക്കെ, എനിവേ ഫൈൻ. സോ ആർ യു റെഡി ആൻറ്റോ?
Yes.
So this is a non-card. We'll display the card on the screen. So how may I address you during
You
the
may
role
call
play?
by my name itself, which is Andrew Sebastian.
Sure. Okay, that's great. Okay, so we'll start.
Please.
Okay. Good morning, Anto.
Good morning.
I'm one of the registered nurses from this hospital. So I understand that you were admitted in the hospital 2 days ago for a cataract surgery, am I right?
Exactly.
Yes, you have gone through the procedure and you're absolutely well now. And I know that you're going to discharge. So I'm here to explain you regarding the aftercare that you will have to take over the care of your eyes. Okay?
Okay.
So before all of these, I would like to know how are you feeling right now after the procedure?
Right now, I would say I'm feeling okay, apart from some slight disturbances.
Okay.
And it feels very itchy too. And I don't feel my eyes as before. That's the main problem right now I'm speaking.
Okay, I'm glad to know that you're okay, but all these disturbances that you experience, let me tell you, these are part of the procedure. It's quite normal. This shows that it's healing well. It's a part of healing process. And try not to worry, it will subside very soon. So please be comfortable. Okay, so as I've mentioned that once you go home, you will have to take up your responsibility of care of your eyes. So let me inform you about the eye drops that you have to apply.
Okay.
Okay, so you will have to do 2 eye drops. You will have to use 2 eye drops once you're going home, after going home. Okay, the first one is chloramphenicol and the second one is dexamethasone. Okay, so I can explain to you how you have to apply this. Chloramphenicol, actually you have to take it twice daily, 2 times daily, and this is for 7 days. Almost a week. Okay. And dexamethasone is again for twice daily, but there is one difference. It is for a longer period of time, about 6 weeks. Okay.
Fine.
All right. So I hope it is pretty clear for you.
Yes, I will try to follow the advice. And I would like to know what to expect after I'm going back to my home because I'm very much concerned about my health. That's it.
That's very good that being conscious about your health. That's absolutely fine, and it's a good question from your side. So that I can explain to you the side effects that you should expect. Okay.
Please, please.
So you may experience a kind of numbness, as you've mentioned that you don't feel your eyes as before, isn't it? So
Yes.
you may experience a kind of numbness for another few hours, but that's okay. And maybe a kind of grittiness and a blurred vision. So let me tell you, don't get panic. These are a part of this procedure, and these are just side effects which will subside very soon. And it's just temporary, and it will be absolutely manageable for you. Okay.
Fine.
Okay, and you'll also get a discharge pack, which includes all the details of aftercare. Okay, so you can follow all those aftercare measures. All right, and if you have any doubt in that, you can contact us. That includes the number also.
Oh.
All right, so now you're willing to go home?
Yes, I'm ready. I'm really, really glad that I got such a good assistance from your side. Now I have an idea what to do and what to expect, really.
Yes, I'm very happy that you're satisfied with the instructions that I've given. Then I would like to add with the instruction the things that you have to be take care of. Meanwhile, your stay in the home, please make sure that you don't rub the eyes. Okay. And also wear sunglasses when you go outside, because exposure to sun, that would cause further complications. So let's avoid all those things, and please take rest mainly for a few days. Okay. And along with this, avoid any strenuous activity. So in conclusion, what I expect from your side is rest during your time at home, at least for a few days. Okay.
Fine, fine.
All right. So anything else you want to know from my
Yeah.
side?
I'm a kind of person who uses sunglasses every time, so I guess it won't be a problem to me. And I will also try to follow all other advices also.
Okay, that's very good. So I would like to remind you one more thing about the use of eye drops, which I've already mentioned. But during the usage, there are certain things that we have to be taken care of because we're dealing with our eyes, so we have to be extra cautious. Okay, so please wash your hands properly before you use the eye drops. because that may cause any infection if you don't wash your hands properly. Okay, to avoid such situation, wash your hands and avoid touching anywhere after washing the hands, and keep the eyes still, and then you can place the eye drop straight to the eye. If you have any assistant from your family, better use that, otherwise you can do it yourself. Okay, and squeeze the bottle and the drops will be into the eye. Okay, so I hope the instructions are pretty clear for you. And as I've mentioned, you can go through the discharge pack if needed. Okay.
Yeah, I will surely check the discharge pack.
That's great.
And I will call you if I have any sort of concerns or doubts or anything. And I'm really glad and I'm really thankful to you, right?
Okay, that's really good that you will be going through the discharge pack. And as you mentioned, if you, any doubt, we're always welcome. You can contact us or you can come to the hospital. Okay. So I wish you a speedy recovery. All the best.
Thank you.
Thank you.
Confirm the reason for your visit. Discharge, aftercare. Find out how the patient is feeling. Hi Antu, looking at your notes, I understand that you had a cataract surgery 2 days before and you're now ready to go home. I'm here to explain to you the areas that you need to be taken care of after your discharge. But before going through those, please tell me how are you now, especially about your procedure. Explain about the symptoms. Example, normal part of healing process. Outline the steps for eye drops. Chloramphenicol and dexamethasone eye drop. Chloramphenicol twice daily 7 days. Dexamethasone twice daily 6 weeks. Find out any concern. It's completely normal to feel some discomfort right now. It indicates that things are progressing or healing as expected. Please try to relax. Regarding the eye drops, you can administer them yourself or ask a family member for assistance. You will be using 2 types of drops, chloramphenicol and dexamethasone. Use chloramphenicol in both eyes twice a day. As for dexamethasone, you will need to use it for 6 weeks, also twice daily. Is that clear? Do you want me explain anything else? Discuss side effects. Numbness, grittiness, blurred vision. Give provision for discharge pack. Details of aftercare. Establish willingness to go home. Well, when you get home, you might experience some side effects like numbness in your eyes, a gritty feeling, or blurred vision. Try not to worry, as these are manageable and should subside soon. However, if anything severe happens, you can come to the hospital, although it is quite rare. Let me remind you of the discharge pack. Every information is included in the pack. Kindly go through those in case of any confusion. This includes hospital numbers, so you may contact us in case of any concern. Give aftercare instruction. No rubbing eyes, wear sunglasses, no exposure to sunlight, no strenuous activity. May I add to the instructions? Please keep the eyes untouched to avoid rigorous rubbing of eyes, and remember to wear glasses whenever you go outside, at least for a few days. Avoid strenuous activities. This will definitely help in speedy recovery. Remind the use of eye drops. Wash hands. Keep eyes still. Avoid touching hands anywhere. Place straight to eye. Squeeze for a drop. Great that you will follow my instructions. Along with this, please be reminded to follow the steps while applying the eye drops. Wash the hands properly to keep the hygiene and keep the eyes still and place the bottle straight to the eyes. Do not touch the hands anywhere to avoid contamination. Now squeeze the bottle for a drop. Hope you will go through all these steps. Your procedure went straightforward, so please be assured that you are healing well. As I have mentioned, in case of any assistance required from my side, please do contact us.
Hope you have enjoyed the presentation, and during the presentation what I focus mainly how comfortable the patient is. So apart from all the criteria that has been listed by OET, the main thing that you have to focus is the language that you present as making the patient comfortable, and do the patient gets all the information in the right sentence. So this is actually the summary of all the criteria. You do not have to check into each and every criteria that OET has listed. Of course, it is according to that you will be marked. നിങ്ങൾ അങ്ങനെയായിരിക്കും മാർക്ക് ചെയ്യപ്പെടുന്നത്. പക്ഷെ പഠിക്കുമ്പോൾ നമ്മൾ അങ്ങനെ മെക്കാനിക്കലായിട്ട് ഓരോന്നേ എടുത്ത് പോവല്ല. മറിച്ച് നിങ്ങൾ ശ്രദ്ധിക്കേണ്ട കാര്യം എന്താണ്? നിങ്ങളുടെ പ്രസന്റേഷനിൽ ആ ഒരു എംപത്തറ്റിക് ആയിട്ടുള്ള ഒരു വോയിസ് ഉണ്ടോ? രണ്ടാമത്തെ കാര്യം, നിങ്ങളുടെ സെന്റൻസ് കൺസ്ട്രക്ഷനിൽ ഗ്രാമാറ്റിക്കൽ എറർ വരാതെ മാക്സിമം നോക്കുക. മൂന്നാമത്തെ കാര്യം, നമ്മൾ കോൺഫിഡൻ്റ് ആയിട്ട് പ്രസന്റ് ചെയ്യുന്നുണ്ടോ, സൗണ്ട് മോഡുലേഷൻസ് ഒക്കെ നോക്കുന്നുണ്ടോ. ഇതിനെ എല്ലാം കൂടി ഞാൻ പറയുകയാണെങ്കിൽ നിങ്ങൾ ആത്മാർത്ഥമായിട്ട് പേഷ്യൻറ്റിനോട് നമ്മളുടെ സ്വന്തം പേഷ്യൻ്റ് പോലെ ഒന്ന് സംസാരിച്ചാൽ തന്നെ ഈ ക്രൈറ്റീരിയ എല്ലാം അതിനകത്ത് വന്നോളും. ഓക്കെ, സോ ഐ ക്യാൻ ഹെൽപ്പ് യു to make good sentence. So you can follow this card with our sentence which we have made. So watch out for that.